Post hair transplant, the precautions that you need to take and the do's and don'ts that you can follow for the next 1 month after hair transplant. Let's look at these in this video. So immediately after hair transplant, your surgeon will let you know when you can wash the scalp. At Tamira, we wash the scalp after 48 hours, and that first wash we preferably advise the patient to get it done in house at Tamira. So our staffs will help the patient to clean the scalp because there will be scabs, which hard sort of material that is formed on your scalp from the exudate that comes from insertion or the donor or the recipient site. And when you try to remove that scab, sometime inadvertently you can pull out some graft as well. And if the graft comes out, there will be profuse bleeding. And hence we give the first wash at Tamira after 48 hours. That is our protocol. There are some surgeons who will not wash the scalp for 10 days or 7 days, etc. But why do we wash after 48 hours? With the temperature, room temperature in the city that I work from and the humidity, if we do not clean the scalp after 48 hours, there is a remote chance of infection. Hence, we carefully wash the scalp under supervision at Tamira. If the patient or the client wishes, we also give a second wash on the following day, after which the scalp is more or less clean and they can take a regular simple wash at home. And while washing at home for the next 10 days, the patient is advised, one, not to stand directly under the shower because the pressure of the waterfall may rarely cause the grafts to come out. Also, we ask patient to be careful about the water used to wash the scalp because in certain places the water is contaminated and that contaminated water can cause infection. The second is where you rest your scalp. So I have seen patients who develop what is called folliculitis because either the donor area as they rest, it could be flight seat or your car seat or the pillow, if it is not a clean one, infection from those surfaces can translate to not completely healed raw areas and that can precipitate infection of folliculitis. So you need to be extremely careful about the surface on which the scalp rests until all the raw areas heal. Now, considering the room temperature and the humidity in the place where I operate from, patients are given antibiotic prophylaxis for 3 days, some anti-inflammatory medication to reduce swelling and also some painkillers. So these are given to all patients. But if hair transplant is done in a place where the ambient temperature, the room temperature or the external temperature is like 8 degree, 10 degree, and the external environment, there is not much of, you don't expect any microbes infection, then even you don't need antibiotic on a long-term basis. Of course, you will need some anti-inflammatory. Patients are allowed to restore their normal activity, day-to-day routine activity after the first hair wash. So in Chennai, where I operate from, we advise the patient to be indoors for 2 days. So after the first wash, they are allowed to go outdoors and they preferably wear a sterile cap which we provide. But after the second wash, they obviously can wear a normal cap, but we advise them to spray some sterile solutions to keep the cap free of infection. Then the routine activity can follow after that. However, physical fitness activities like jogging, running, gym, all activities can be resumed in about 10 days to 2 weeks. Absolutely safe. There is many patients ask me, is it okay to sweat? Absolutely, this normal sweat is not infected and so you don't have to worry about it. You're perfectly okay to sweat during your fitness activity. Once all the raw areas heals, it's just for your comfort. So 10 days you can rest, to 2 weeks you can resume all of them. What we advise the patient not to do for about 30 days after the hair transplant is not to retrim the areas where the grafts are placed or they are harvested, because inadvertently when they are doing, if there is any folliculitis area or they can injure the grafts. But you can trim your beard after maybe 10 days when all the raw areas heal. We advise them not to use any topical application other than what we prescribe on the scalp also for a period of 30 days, which includes even hair coloring. And of course, tight compressive gears like wearing a tight handkerchiefs, which some people do, or some require to wear a very tight cap for religious purpose or helmet. All of these, anything that is very tight on the scalp to avoid for 30 days. And of course, public water where there can be contamination like a swimming pool or any other places. So these to be avoided for 30 days from hair transplant. So these are the precautions that you need to follow after hair transplant. So these are the things that you need to know, what you can do and what you should not do after hair transplant.